It's absolutely a pleasure to have you all here and looking forward to a great meeting. My name's Nigel Pollard. I'm the chair of the non-profit Empowered by Evidence. We're located in New York, and we were established in 2014 to help to inform people about choices of natural health products based on evidence, and in particular about the reliability of the product as well from batch to batch, so that you can link the evidence to the products that you can prescribe. This meeting is about helping healthcare professionals making informed choices of products, and obviously in the interests of their patients. The model that we've built for today, and we have a number of other webinars coming up in the course of this year, is to have a medical professional helping to give us the context within the mainstream medical setting of where natural health products fit. Okay, so I'm going to kick off with our first speaker, and before I do, I just wanted to let you know this is an interactive event. So in the chat, please put any questions in there. You can either make them privately to me or make them to the whole group. And what we're going to do is we're going to hold all of your questions for a panel discussion at the end. So we'll do the 3 talks without questions, but please send any questions and we'll moderate that for the final half an hour of the meeting. Very good. So our first speaker is Dr. Oren, who's chair of psychiatry at Tel Aviv Medical Center. But he's a psychiatrist and a brain researcher and lecturer at Tel Aviv University Faculty of Medicine. In his research work, he studies the complex interface between psychiatry and neurology, focusing on brain mechanisms that influence human behavior. I think you'll see some of these skills about the human brain in his very interactive talk that you're about to see. Over to you, Oren. Take it away on rethinking anxiety care, unmet needs, and the potential of natural health solutions.
Thank you. Thank you very much for having me. So I'm sharing my slides, and we're going to talk about rethinking anxiety today. I first of all want to acknowledge and thank Schwabe for sponsoring this talk. Thank you to them. So let's start straight off with a patient of mine named Sarah. Sarah is a 51-year-old woman that is mildly anxious, was all her life. But since her daughter was diagnosed with eating disorders, at 51, you have more worries in your life. She tells me she can't sleep, she can't concentrate, she can't work. So that's Sarah. David is another patient. He's 76 years old. He's not anxious, as he puts it. He just says he thinks too much, and his children tell me he watches the news all the time. I'm from Israel. The news is never good here. His wife is cognitively declining, which is a stressor for him, and he still wants to continue driving, although he also has multiple health issues. So why are we seeing so much anxiety in clinical settings? Did this start with COVID? So I think the answer is no. And if we revisit 2017 for just 1 minute, and in 2017, Corona was just this, a beer, yeah? That was a small, here it is again, like a commercial for Corona. I cannot believe that this brand survived the COVID-19, but it did. So anyways, 2017, we didn't know what COVID was. And still, if we looked at the National Institute of Mental Health, did a registry that year and showed that 30% of Americans have a lifetime prevalence of an anxiety disorder, one diagnosed according to DSM-5. Many of them, many more women than men, as we know, a very young age of onset, 11 average age, and a disorder that affects all life throughout the life. That's why we know it has a huge economic burden. It was so severe, the anxiety plague still plaguing the United States, that the New York Times, that this is a piece from 2017, says we're not the Prozac nation, as we were put in the 90s with depression. We are now the United States of Xanax, talking about the anxiety. And in 2017 here, they interview a woman named Sarah, and she says, if you're a human being living in 2017 and you're not anxious, there's something wrong with you. And it's interesting, she said it on the telephone. This is 2017, 8 years ago. Who speaks on the telephone today? Things are so quick. So I want to ask why, and I don't have the answer. I'll give you my answer. I think that humanity, we're living in special times and that we're proceeding in different and opposing axes. One is the control revolution. We feel we're now in the Zoom talk, we're sitting in air-conditioned spaces. We feel that through science, we control everything. Western world, man at least feels that it controls everything. Not one of my patients he's a very serious man, and he says that human history will end soon when man becomes God. So we're going to be gods. Did you know that we're going to be gods? So when I'm asking, are we really a God? I'm not sure about this. I don't think it's too fast, because the other axis is exactly the opposite axis of a terrible feeling of losing control, which I think is demonstrated best with climate change. We're heading into this terrible disaster and we can't even do anything to stop it. We have lost control. And that's not all, because the third axis, I called it the matrix revolution. And why the matrix? Because if you remember in the movie, the brains were harvested somewhere in a farm and just connected via maybe Zoom to their workplaces. And what's different today when we can work from far away and we don't need to bring our physical self, just our brain is needed and attached through computers to other places. And that same brain attacked all the time by multiple teasers, triggers, and so many things that we aren't used to, that evolution has not readied us for. And this is a very special slide. It shows how the human brain has developed in the last 225 years of these revolutions, and as we did not develop. So I think that these are maybe some of the answers as to why we're living in terrifying times, very distressing times. So we see a lot of anxiety, and the two main manifestations of anxiety, if we can speak about the two, is paroxysmal panic attacks, something very hard to miss. I will not talk about this because this is like a very obvious many times diagnosis, but a more subtle diagnosis is that of ongoing anxiety related to generalized anxiety disorder, which is very easy to miss, many times misdiagnosed as depressive symptoms or not diagnosed at all. We see when we talk about ongoing anxiety, a lot of unspecific symptoms. For instance, sleep disorders, people coming into general practitioners complaining about their sleep. Think about Sarah and David at the beginning. We see people becoming irritable and being easily angered. We see a lot of somatic symptoms. So again, nothing really specific that tells us this is an anxiety disorder. But this triad of symptoms, which is very classical for generalized anxiety disorder, is many times is overlooked at primary clinical settings. And it's important to look at it because most patients will tell you, if you ask them, that they feel they're too worried, that they can't stop worrying, that they are locked in a circle of negative thoughts about realistic things. It's not OCD, being afraid of germs, doing something bad. It's realistic worries, but the people feel that they're just locked in this circle and cannot release themselves. And sadly, our treatment options for GAD and for anxiety are quite limited, and not a lot of new things have been developed in the last 20 years. And if we look at the field of depression, we see there's TMS and there's esketamine and there are a lot of new, and they're talking about psilocybin, a lot of new treatments. And in this field of anxiety, which plagues humanity more than depression, we have very little development. And that's why we need all the help we can get here. And that's why for me, it's important that we also know the herbal medications that can help us. So the basis for treatment is still the old and good combination of tox and meds. And when we talk about tox, we talk especially about CBT, the most studied interventions, but I tell my patients, whatever works for you is good. But I will not speak about psychotherapy today. I will speak more about the meds. So the meds we use for anxiety disorders are, of course, the SSRIs and the SNRIs. And we also use sometimes the tricyclics, older drugs, but very effective with more side effects. We use benzodiazepines, although they're not recommended for anxiety disorder as a whole. We use other medications, sometimes like antipsychotics in a lower dosage or antihistaminic medications, which also have their side effects. And I also want to talk about the option to use Siloxane because, as opposed to the other medications, which are all very good and all have a place, we need I think, all the help we can get here. But Siloxane has the potential to being a bridge between efficacy, clinical efficacy, and safety because it's very easy to use and very safe. But I want to talk for just a minute about my hypocrisy. I don't know about yours as a physician when it comes to herbal medications, because many doctors, on the one hand, when they know a remedy is from herbal origin, they would say, this is placebo. On the other hand, we say, oh, we don't know what's in it. It might be dangerous. Cyanide is also a herbal medication. So it's very interesting that both can't be true, but maybe they are because we know that a medication doesn't matter really where it comes from. It can be dangerous or it can be placebo. It doesn't matter if it's herbal or synthetic. So the brain, I always say this, doesn't have a special admission committee for molecules, and it say, oh, you're herbal, come in. Oh, you're synthetic, go out, vice versa. A chemical is a chemical, and it can heal or harm regardless of origin. Okay, so what do I want to know when I use a herbal medication? I want to know what's inside. I don't want to give cannabis to patients, and I have no idea what they're using, who grew it, and where. I want to know that it doesn't matter where the medication came from, it has exactly the same ingredients, and I know the milligrams and I know exactly what I'm prescribing them. So that's extremely important for me. And that is something that only big pharmaceutical companies using herbal medications can do for me. And the other thing is, I want to know that it works. So I want to see studies that show me efficacy and show me safety. So let's talk a bit about Siloxane and ask what do we know about this medication. So older already studies, this Siloxane has been studied for many years now. So older studies have shown us that the mode of action, first of all, is not the regular mode of action of SSRIs. And I like this because it's not more of the same. It's a different mode of action. It actually modulates calcium channels in the presynaptic junction. So this is a different mode of action than the SSRIs. But still, it has also serotonergic qualities, as we see in this study in healthy adults, because almost every drug or remedy that helps with anxiety and depression has some touch to serotonin that I've learned from my teachers. So here we see that it does also affect. So it has a unique, probably, mode of action. We have already seen proof of efficacy, and this is the largest study done by Casper and colleagues in Germany, multi-center trial, almost 500 patients, which checked Siloxane compared to placebo and to paroxetine, which is a very good drug for GAD in generalized anxiety disorder patients, and demonstrated efficacy equivalent to placebo, to paroxetine, and better than placebo for both drugs, showing the methodology of this trial was good. So this is a very important study for Silexan, showing me that I have another tool as effective as paroxetine to treat my patients. And then we have also studies showing us that Silexan has a special effect on the somatic symptoms that really sometimes burden our patients so much with anxiety. This is a study showing the efficacy on a lot of bodily sensations, but let's look just at some cardiovascular symptoms, preferring Silexan to placebo, bodily pain, preferring Silexan to placebo, sleep, insomnia, preferring Silexan to placebo. If I can help my patients just a bit with their somatic symptoms with a very low price of side effects, this is the important part, a very low price of side effects, no weight gain, no sexual dysfunction, no addiction, no sedation, and no known drug interactions, then if it helps them, it doesn't help everybody, but if it helps them, it's a great profit for me. A few near studies about Silexan. So this is a bigger meta-analysis recently published already in almost 1,213, not almost, exactly 1,213 patients, again showing that Silexan is better than placebo for many of the traits of anxiety and all kinds of anxiety and anxiety-related symptoms. So that is a new one. And we also see that
5 minutes, Oren. Sorry to
no
interrupt.
problem. That not surprisingly, I started very fast talking, and now I can see I can speak a bit slower, so maybe you'll also understand. And not surprisingly, we see that Silexan also helps with depressive symptoms that many times are related to the anxiety symptoms we see. This is a study showing that how the question about depression has improved when anxiety improves. Again, not a surprise, but a very interesting finding to see that we can also reduce depression. Now, Silexan probably has a very good influence also on sleep, which is a huge economic burden for society and a huge burden for patients when they don't, whoever didn't sleep well for a few nights know what I'm talking about. So this is a study showing that the effect of Silexan on sleep is actually not through sedation, but through its anxiolytic effects. And that's extremely important because we don't want a sedative drug that causes dizziness, sedation, falls, etc. And Silexan, we saw only improved the sleep quality when it improved anxiety. So it's not a sedating agent as itself. And this is a nice study showing real life scenarios that we saw patients coming in after receiving either a Z compound or Silexan for sleep and who visited the general practitioner after giving this prescription. So this gives an indication if it helped them, because if they revisited with the same complaint, it didn't help. And we see that many more patients with the Z compounds revisited their clinicians than those who received Silexan. And the fact that Silexan does not affect driving has a huge advantage. A huge advantage. The fact that it's not sedative and does not affect driving has a huge advantage because, as we saw with my patient at the beginning, David, he wants to continue driving, and we don't want our patients to go driving while they're sedated and not very concentrated. This is a study showing, again, in healthy adults with very large quantities of Silexan. No, those are the three bars. No effect, and only 1 milligram of lorazepam, a huge effect on their driving capability. So this is also something we should consider. This is a newer study showing Silexan in adolescents. It's not prescribed for adolescents. It's not indicated for this population because not enough of study here, but in real life, probably adolescents take it. And a study shows that it might be also a good solution for them. Again, a drug with hardly any side effects that might help them. What side effects can we expect, especially intestinal ones, but usually very mild. Contraindications are only if we know of an allergy to the substance or if there is a severe liver impairment. And we haven't studied this drug in children or pregnant women or in lactation. So these populations also, we cannot prescribe the drug. Silexan, maybe not surprisingly, is the only drug from a herbal origin that is included in the official guidelines of the World Federations of Biological Psychiatry. This is a shrine not easily entered. Alongside synthetic medications, Silexan, they did include it. Both my patients started Silexan 80 milligrams once daily. Sarah improved. She said she sleeps better and she is less worried and she's very happy with the medication. David didn't improve as much, which shows that it's just another tool in our toolbox that we have to sometimes utilize to the best of our knowledge and ability, but it won't help, of course, everybody. We still have to offer our patients with anxiety, maybe like Winston Churchill, a lot of blood, toil, tears, and sweat until they reach maybe remission. But it doesn't mean we can give up on any tool that can aid us in this fight towards their freedom from anxiety. So thank you very much for the time. I think I was right on time, right, Nigel?
Perfect. Excellent. Thank you. And great. I love the slides. They're really fantastic. So really appreciate that. And looking forward to speaking with you in the panel discussion at the end of the meeting. So thanks, Oren. And please share this with all colleagues, anybody in your networks, because we want to help as many people around the world as possible with their informed based choices. All the best, and thank you so much to the speakers. It's been a real privilege to work with you.